Thank you for joining us today, and welcome to the UnitedHealthcare Global COVID-19 webinar. Please note that all panelists are on mute as well as attendees. This webinar is being recorded. Please welcome your host, Ben Hawley, National Vice President of Sales for UnitedHealthcare Global.
Thanks, Erin, and thank you to everyone who has joined us today for our latest update on COVID-19. This is obviously a topic that is top of mind for everyone right now. It is certainly developing very quickly, so even though we have run a number of these webinars this week and last week, we are happy to report that there continues to be updated information. We really wanted to get everyone together today to do a couple of things. First of all, again, provide the latest information that we have on COVID-19 and be able to also share some of the strategies that you all can use as businesses to help protect your people and really have a baseline of understanding around what is the current situation with COVID, what are the advisories around travel and how to protect yourself, and then certainly offer an opportunity for you all to ask questions as well. So a couple of housekeeping items before we go in. You are able to submit questions through the chat feature on WebEx. We will be collecting those questions. We will leave time at the end for questions and answers. So if you do type in a question and we don't immediately answer that question, we will get to them at the end of the webinar. I am also thrilled to be joined by Dr. Arwindekar, who is our Chief Medical Officer for UnitedHealthcare Global in the North America region. And just a quick update, we do try to bring relevant content to everyone. So our teams really are dedicated to helping multinational organizations, whether or not it's in a pandemic event like we find ourselves now, or just with relevant content to help you all operate in the global environment. So again, we know this is a timely topic and everyone is very interested in it. So without further ado, I'm going to turn it over to Dr. Arwindekar and take us through the latest medical information that we have on COVID-19. Dr. Arwindekar, all yours.
Thanks, Ben. And I want to thank everyone for joining us here today to get an update. The last 72 hours have certainly been dynamic, and we've seen a lot of changes with our current situation. So let's get to an idea of what's going on. I want to just start out by saying that we're going to make three big points today. The first point is that over the last few weeks or so, the epicenter of our pandemic has really shifted from being Asia-based to being much more in the Western Hemisphere, in the United States and in Europe. The second thing is that we've seen a lot of measures being put into place over the last 2 or 3 days, which seem really significant and profound, and we want to go over a little bit the risk that is underlying all of this, why these are being done, and discuss what the populations that we're trying to protect. And lastly, we want to talk a little bit about what we can do as individuals and as businesses, and what effect we hope to see through these interventions. So we'll be talking about those three things, but we're going to do just some very basics, which I'm sure many people have heard already about the coronavirus. What is it? Coronaviruses are an entire family of viruses which have existed for a very long time. They are well known to people and animals. We've seen a few in the last couple of years which have made the news, particularly the severe acute respiratory syndrome coronavirus, SARS, as well as the Middle East respiratory syndrome, MERS, which had significant outbreaks within the past 15 years. Coronaviruses are much more common than that. They are responsible for a large number of common colds that we've all experienced, and their spectrum of disease goes from being very, very mild infections all the way up to people getting very sick and even dying, as we've seen with a few cases of the current COVID-19 virus. How is this virus spread? Primarily today, the way this virus is spread is through person-to-person transmission. Uh, Early on in the outbreak, we believe that there was more transmission from animals to people, but as of today, the vast majority of the transmission is person to person. To give you an idea of roughly how contagious this virus is, it is about as contagious as influenza, the flu. So for every person who becomes infected with corona, we typically expect them to infect two other people, which is why we are seeing some of the dramatic spread in areas when it comes to new regions. So where has the virus spread? Right now, we are in, it says 114 countries, but the latest data, which it came in about an hour ago, says that we've reached 117 countries around the world. We have 137,000 confirmed cases with roughly 5,000 people who have passed away from this. The good news in all of this is that our number of people who have totally recovered continues to climb, and we're rapidly approaching approximately 70,000 people who have recovered completely. The vast majority of these cases, both for infections and for deaths, still remains out of the Asian region, China, and some of the surrounding countries, South Korea. However, what we've seen as far as new cases coming on, for the last several days, China has reported very few cases which are new. We have seen many, many more cases and much more rapid growth of the virus in other areas, particularly in Europe, Italy, and the United States, as well as Iran, and Germany, and Spain. And that is the rationale behind why we're saying now that the real epicenter of this disease has shifted into the Western Hemisphere, particularly North America, the US, and most of Western Europe. So this remains an emerging virus. We have only been dealing with this virus now for approximately 3 months. There's still a lot left to learn about this. A lot of the questions we get are what's going to happen next, and we're still working on that. The data is continuing to come in. Scientists around the world are working at an extraordinary pace to learn more about what they can do to help and what we can do to slow its spread. Some of the things that we do know about this virus is that it does not affect everyone equally. The vast majority of cases tends to occur in people who are younger, and in this case, we're going to refer to younger as less than the age of 60. And in those people, their burden of illness is much lower. Many of them have almost no symptoms. Approximately 80% of the people who become infected with COVID-19 have either no symptoms or very, very mild symptoms, which is to say a mild cough, cold, body aches, but do not progress to severe disease. What we've found is that the mortality for people who are young, less than 60, tends to be very, very low. Whereas once you get over 60, the mortality goes up significantly. And so a lot of the efforts that we are seeing right now is compared to how can we protect those people who are most at risk, meaning those who are over the age of 60. The death rate from COVID, we've seen a lot of varying numbers from around the world. We've seen some sort of a broad range. And right now, the best data suggests that the mortality rate is probably around 0.7% from the places that have the best data. The one thing to be cognizant of is that that number is pretty large when you compare it to something like the flu, but it's important to remember that in a lot of these places, we don't have the full number of cases because the testing has not been very widespread or as widespread as you would need to know. This is one of those areas where the final mortality of this disease will not come in for another couple of years, but is likely only to go down at this point rather than going up. So the numbers that you're hearing in the news right now, they tend to be somewhat dramatic, but I would ask you to keep in mind that as we learn more, this data is going to come down and we will likely find that it's not as deadly as we currently believe it to be. And I'm happy to answer more on that later if questions come up. Okay. How is this virus spread from a person to a person? This virus becomes droplets and particles that are spread into the air when someone coughs or sneezes. This is a very common way that upper respiratory or cold viruses are spread when someone coughs, sneezes, or touches their mouth, or what we refer to as a mucous membrane, their nose, their mouth, and then touches an object or touches another person. That person will, when they touch their own mouth or their nose, can infect themselves or become infected when they walk through the cloud that someone has coughed. That cloud roughly is approximately 6 feet wide or 6 feet in diameter, roughly 2 meters. And that is considered to be the infectious area around someone who is sick with COVID. So as I said, the infectious area around someone who has COVID is roughly 6 feet when they're coughing, sneezing, or throwing these particles into the air. And anyone who walks through that area can become infected. Right now, we're not exactly sure how long you need to be exposed, but the current data suggests that it's somewhere around spending 10 minutes with someone within 6 feet of them while they are ill is enough to put you at risk for an infection. And this is the criteria that's often being used to designate who is or is not at risk for COVID when it comes to in terms of testing. Common symptoms of COVID-19. So as I said, first and foremost, there's a wide spectrum here. Some people are actually displaying almost no symptoms at all. Some are displaying mild fevers, body aches, fatigue. But what we're seeing most commonly is a combination of fever, cough, and shortness of breath to varying degrees. The sore throat, diarrhea, body aches, fatigue, production of sputum, coughing, of small amounts of blood sometimes. Headaches and nausea have also been noted, but have been much less common. As I mentioned before, the population under the age of 60 tends to get typically very, very mild symptoms, meaning a little bit of fatigue, feeling run down, or feeling like they have a cold. In the more extreme cases, we are seeing people, particularly those who are elderly, over the age of 60, or with complex medical problems, weak immune systems demonstrating pneumonia, or having severe difficulty breathing, kidney failure, or up to and including death. One of the questions we often get asked is asthma considered a high-risk feature? This is, once again, still early on in this disease's course, but we're finding that asthma is not related with more high-risk features. We're seeing many more people having severe illness if they have heart disease, COPD, or high blood pressure, which also corresponds with being older. What should you do if you feel like you may be developing symptoms of COVID-19? Most of the interventions around COVID-19 are related to limiting the spread, as I said before, because the vast majority of these cases tend to be very mild. If you feel like you are getting sick, first and foremost, please avoid public spaces, including public transportation. Avoid going around people who are older and may be at risk for catching the disease. This includes people who are over the age of 60 or very young, and very young in this case means anyone under the age of 1. The best you can, self-quarantine. Stay at home, stay away from other people in your home as best you can. You can designate one room for yourself with a bathroom. That is the best situation. If your symptoms become more severe, which is to say you start developing shortness of breath, confusion, difficulty breathing, then go to an emergency department. We're not recommending people go directly to their doctors at this time. It's best to contact them in advance. And most health facilities are doing their best to prepare and trying to move people who have symptoms through a separate process that limits exposure to other people. One of the things that we said earlier was that please don't go to your emergency department if you're having mild symptoms. This is twofold. One is if you don't have COVID-19, there's a chance you may become exposed to it if you go to an emergency department where people who are ill tend to congregate. Conversely, if you do have COVID-19 and you go there unannounced, it is possible for you to infect other people. If you are in China and South Korea, there have been specific hospitals and clinics set up for people with symptoms called fever clinics or government designated hospitals. And those are the areas, the facilities that we have recommended anyone in Asia to go if they're developing symptoms or they believe they may have the illness. In all other countries and in the United States, local health authorities and national health authorities have set up specific, usually hotlines. When it comes to limiting the spread of the disease, there are two big components. The first one is social distancing, which we talked about earlier, self-quarantining, staying away from large groups of people, gatherings, and self-quarantine. The other one is good hygiene. And one of the big questions has always been, are masks helpful? Are masks something that we should use? The general consensus on this has been that masks are not helpful in protecting you from this virus. The masks do not provide sufficient protection for you, but they can help others if you are sick. When you cough, if you're wearing a mask, the mask tends to limit the spread or the size of the cloud of virus particles that you create, which can help limit the spread. We are not recommending that people use masks, but if you feel like it makes you feel more comfortable, a couple things you should know about using a mask. First and foremost, it needs to be put on correctly. It should cover above the bridge of the nose and below the chin and be worn tightly. When you dispose of your mask, please make sure you dispose of it correctly, which is to say, throw it into a closed trash can or trash bin. If you are infected and throw it into an open trash can, it can become a new source of infection if it throws those particles into the air when it gets shaken. When covering your nose and your mouth, ensure there's no gaps, specifically around the sides or the bottom. Avoid touching the mask or adjusting it at all possible. If the mask becomes damp from coughing, sneezing, or anything else, that becomes the time you need to remove the mask and dispose of it. And the much more effective intervention, other than wearing a mask, has been hand washing. Washing your hands with soap and water for at least 20 seconds is key, and using an alcohol-based hand sanitizer if hand washing is not available of at least 60% is believed to be effective. Current treatment options. So first and foremost, there is no current vaccine for COVID-19. There are several attempts and movements to develop one, but there is nothing currently available. There is no specific treatment for COVID-19. Supportive care has been shown to be effective in helping the vast majority, and when I say vast majority, over 98% of people who contract this disease get better. That supportive treatment typically includes making sure people stay hydrated and giving them breathing support if necessary. And that breathing support can be anything from a little bit of oxygen all the way up to mechanical ventilation if needed. One of the questions that we get often is, as we're talking about social distancing and care for COVID-19, is it a good idea to forego routine medical care at this time for things like physicals and other routine care you need, that is a question that I would say we should refer to your doctors, because that will be a very dynamic situation. Doctors' offices vary in how they're handling this, and if they are becoming overwhelmed, they may tell you to stay home as they deal with the sicker population, or they may be willing to accommodate you if they've made other accommodations for the patients with this pandemic. What can you do to protect yourself from the virus? First and foremost, it's social distancing. So the CDC currently recommends not traveling to areas where there is a widespread outbreak, including China, Iran, Italy, South Korea, and cruise ships have been found to be an area where there is a lot of widespread uh, disease. And of late, they have, within the last 48 hours, they've actually recommended that you reconsider all global travel as they deem it potentially risky at this time. Second thing you can do, once again, wash your hands, soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer if soap and water are not available. Avoiding contact with your eyes, nose, and mouth, which is easier said than done, but those are your eyes, nose, and mouth are the primary areas where this infection gets into your body, and avoiding contact with them will help decrease the spread. Avoid close contact with people who are sick. And conversely, if you are feeling ill, if you're feeling sick, making it a point to isolate yourself from others. So not going into work, not going to public gatherings, staying away from people, particularly those who might be at risk for catching the infection, namely those who are over the age of 60 or have chronic medical problems. The vast majority of people who are under the age of 60 will have a very mild illness and up to no symptoms, but they are the primary vector that spreads this to other people. So if you are feeling ill, it is best to try to limit your contact with other people to keep them safe. Clean and disinfect frequently touched surfaces. This includes your phone, your computer, bathrooms, sinks, rails, doorknobs. The flusher on your toilet is another common area that improves with that needs to be disinfected and is often overlooked. When you cough or sneeze, make sure you cover your mouth and your nose. Coughing into your elbow is preferred over coughing into your hands. If you do cough into your hands, please use a tissue to try to contain both droplets that you spread and limit the size of the cloud. If you are sick, stay home. If you have workers who are ill, encourage them to stay home or work from home as much as possible, and refrain contact with livestock or wild animals. We have found that household pets, dogs and cats, typically do not spread this virus, but livestock are possible to spread it. One of the big questions, particularly when it comes to international business travelers and globally mobile populations, is what can we do regarding transporting someone who is sick, particularly across borders? First and foremost, anyone who is in a current quarantine or in a treatment facility designated for the treatment of COVID-19 cannot be moved. This has to do with regulations both domestically and internationally, as for the safety of that person, as well as the safety of people outside where they would be going and areas that they would be traveling through. Any medical transport, if possible, for a confirmed case or a potential case, requires a biocontainment unit. A biocontainment unit is the standard that was created during the Ebola outbreak several years ago to protect healthcare workers as well as the general public when transporting someone who is highly contagious. Also, that transport will require the agreement of national authorities, both from the place that the patient is disembarking from, where they are leaving from, as well as where they would be going to, and oftentimes will require the agreement of any countries that that patient is traveling over or traveling through. Commercial transportation, meaning public airplanes, commercial airlines, cannot and will not be considered. There are restrictions against this, and would only increase the number of people exposed if used. The other thing which is very important to note is that the travel restrictions which are being placed in response to COVID-19 have affected the movement of patients who are not currently infected with COVID-19. Access to medical care and movement for people who have other illnesses, whether it's heart attacks, broken legs, strokes, what have you, is affected and limited as countries are moving to try to contain the spread of the virus. And this is something important to know for your populations around the world, that their access to medical care outside of the treatment of COVID-19 may be limited, and their access to the ability to move outside of a country where there is a current outbreak will be limited in the setting of this virus. Guidance related to international travel. First and foremost, we are strongly recommending avoiding travel to China, Iran, Italy, South Korea, and on cruise ships. This is guidance that is obtained from the CDC as well as the WHO. If you are interested in a list of current travel restrictions that is country specific, I would recommend Googling IATA, which is IATA, and the word coronavirus. It is the International Association of Travel Airlines, and they maintain an up-to-date database of current restrictions if you're traveling between any two countries, what those restrictions are. It is very helpful for our international travelers. It is best to check on the current situation in the country you're going to, as it is dynamic and consistently changing right now. Most international airports and ports of entry have implemented screening programs. Those screening programs typically revolve around temperature checks, and we're encouraging everyone to participate in those, as it is for the safety of everyone involved. Travelers who have contact with a confirmed case or direct exposure to someone or a source of infection should be placed on quarantine, typically for 14 days. I know there's been some news in the recent media about that the incubation period may be longer than 35 days, longer than 14 days, up to 35 days. That is something that is not confirmed, and I can't really recommend it. It is important during this time, and we'll talk about this in a little bit, where you get your information from during these times of dynamic change are very important, and the current guidelines suggest that the incubation period is 14 days, and that is typically how long quarantines are held for at this time. At this point, I'm going to hand it over to Ben to discuss some of the business preparedness steps that we should consider.
Excellent, thank you. So I have a number of things to talk about. I thought as we got a bunch of questions related to this and does have to do with business preparedness, one of the things that we have been asked quite frequently is, A, how do we maintain social distancing within an office environment? And related to that, should we be considering having our employees work from home and instituting those policies, as a lot of companies have done that? First of all, certainly anyone that has symptoms, even if they're mild, should be staying home at this point. So exposure is going to be obviously the #1 way that this continues to be transmitted. So it is definitely a good idea to have anyone who's exhibiting symptoms to stay home. But Dr. Arwindekar, just from a practical standpoint for people who are still going into an office and going to be there, what are some of the sort of pieces of advice that you would give to them if they are going to continue to be in the office environment?
For people where work from home is not an option, a couple things you can do to keep yourself safe and keep everyone else around you safe. Promote healthy habits, so make sure that your employees have access to water and are staying well rested and are not increasing their risk for infection. Make sure that their workspaces are clean and disinfected. So making sure that the trash is removed on a regular basis, usually daily, so that anyone who has been coughing or sneezing doesn't leave something behind to infect other people. Making sure surfaces that are consistently contacted by people are disinfected, including countertops, tabletops, computers, and particularly bathrooms, doorknobs, rails, sinks are very important. And then practicing prevention efforts. And prevention efforts really mean anyone who's sick is can go home, work from home if they need to, but has the ability to take the time off. And then also knowing who are your employees who are at higher risk, either for bad outcomes or for infection, and then making accommodations for them as much as possible. And I think the single most important thing is, as we're moving through these rapidly changing times, making sure you're getting your information from reliable sources. There's a lot of information out there which is swirling, often contradictory, and is raising the level of panic. Making sure your information is coming from reliable sources that are authorities on this matter. All of the information that we have been providing today has come from the CDC and the World Health Organization, as well as the South Korean and Chinese CDCs.
Excellent, thank you. Okay, so one of the things that this current outbreak has really highlighted is the need for emergency response plans within organizations. So I would assume that a lot of you already have these. If you do not, creating a detailed emergency response plan is an excellent idea and something we would highly recommend. It is something that can go into place not just for a pandemic outbreak such as this, but really any kind of challenge that may arise around the world, whether or not that be a natural disaster, a terrorist attack, political unrest, or certainly in medical situations such as this. Some of the things that you really want to make sure are well defined within that emergency response plan are the roles and responsibilities. So who is going to be doing what? Where are the folks that are going to be actually conducting this plan and implementing it, and making sure that all of those people completely understand what their role is, what the duties that they have as part of the response once an emergency is triggered. For this particular type of an event, work from home and flexible schedules and travel restrictions are certainly something that should be taken a look at. So for organizations that have the ability to have their populations work from home, it's an excellent idea to go ahead and do that. But also offering flexible schedules for folks so that they have the ability to address things like childcare. A number of school systems around the country are closed. Some are closed indefinitely. So recognizing that that may have impacts on people's ability to work their normal hours, having them the ability to have flexible schedules will be important. And then in terms of travel restrictions, there are a number of places that you can go to look for these travel restrictions. Certainly the State Department here in the US will have travel restrictions. The World Health Organization, the CDC, has travel advisories. So taking a look at where those advisories sit, what level they are, and updating your travel policies internally is something that should definitely be taken a look at. The other thing, and this is often a very challenging aspect for organizations as they're dealing with and trying to respond to global events, is actually understanding and knowing at an accurate level where all of their employees are around the world. And we continually find that this is a challenge when something takes place. They have a hard time figuring out where their employees are. And there are a number of tools that are available, such as travel tracking tools and other things which can be implemented to easily be able to track the movements of your employees, but having that accurate count of where everyone is around the world, and then a means of communicating with those employees is also really important. So once you've been able to locate them, understand who may be impacted or impacted the most by events around the world, how are you going to be able to communicate a proper response and what they should be doing? Depending on the type of situation, oftentimes communication, two-way communication can be challenging. So one of the ways that organizations can get around this is to create an in case of emergency line and share that number with all their employees. That actually allows employees who maybe are difficult to reach to call in, leave a message, let you know as an organization that they are okay, and how best to be able to communicate them for the duration of that particular event. So a couple of things there just to think about for your emergency response plans. The other thing that can be overlooked is that as people change roles, making sure that it continues to stay updated. So if you were on point to coordinate a certain part of the response and you've moved to a new role, making sure that the person that comes into that role understands what their responsibilities will be, assuming it will transfer over to them, so that everyone, again, is well informed on what they need to do and how they are involved in the response to the particular event. Other things, again, employees who are at risk for exposure should be identified and perhaps sent home. Certainly anyone that has symptoms of sickness at this point, it's a great idea to make sure that they are allowed to leave and that they understand that they are able to take their sick pay. So creating that open lines of communication, as well as there is still some stigma and fear around what will happen if I tell my employer that I've contracted COVID-19. Certainly one of the worst things that can happen is if an employee does contract the virus, feel that they're not able to come forward and be honest and take time away and then go into the office and continue to affect people. So making sure that it's very clear and understandable that this is an illness, it can happen, but if you do have symptoms and or have been tested positive, that you inform your employer and are able to inform your employer without sort of any kind of risk of repercussions from the employer. And then again, I will highlight once again, obtain information from reliable sources. There is so much information out there right now, and it can be a little bit confusing. So the ability to get that information from trusted sources is really important. So a little bit on sources. Again, Dr. Arwindekar mentioned all the information that we have provided here have come directly from the World Health Organization, the U.S. Centers for Disease Control, as well as a couple of other countries' CDCs. We have gotten some questions in our question and answer around where we are getting the numbers of current infected, deaths, and recovered folks. That is coming from the Johns Hopkins Center for Systems Sciences and Engineering. Anyone can go to that website. It is open to the public, and they are monitoring and updating regularly their figures. You can see individual country information within the U.S. You can see individual state information as well. So it is an excellent resource if you're trying to figure out how widespread a particular outbreak is in a particular location, state, country, that sort of thing. And then finally, for travel warnings and updates, IATA is an excellent option. It will go over not just recommendations and restrictions from the US, for example, but for other countries as well. So getting an accurate idea of if I travel to a location or if I have a trip planned to a particular location, are there any restrictions, as well as if I am there and upon return, what will be the likely restrictions and or quarantine period, if any at all. So again, I would get all of your information related to COVID at this point from these sources. We know them to be accurate, and we know them to provide the most up-to-date information at this particular point. Dr. Arwindekar, anything to add there about sources?
No, I think those are the key sources that we use for pretty much everything, and I would be cautious of information obtained by social media.
I would definitely agree with that as well. Okay, excellent. So I wanted to also touch on another aspect of this current pandemic that I think has been a little bit lost in the current environment. Certainly, there is a lot of communication around the effects of COVID-19 specifically. However, what we have not heard a lot of coverage on and thought it was really useful to call out is that the environment that's been created around COVID-19 has really struck a lot of fear in people, as well as some confusion and stress. And so understanding that regardless of whether or not you are at high risk or actually have come in contact with someone with COVID-19, there is a lot of stress in the current environment. People are questioning whether or not they should be around other people. What should they do? How are they going to manage this? What's going to happen in the future? So we are seeing certainly an increase in stressful situations. And when you have those, some of the feelings can actually be similar to the symptoms that would lead someone to potentially believe that they have contracted COVID-19. So headaches, dizziness, nausea, hard time sleeping or eating, and certainly a lack of focus. So just a call out here that aside from just COVID-19 and your response there, again, making sure there's an open environment that if people are feeling very stressed out about this or concerned about their safety in the work environment, make sure that they understand they can ask for help, point out solutions for them to be able to contact someone and be able to express their feelings and get support is really important. And certainly one of the best areas for that is the promotion of employee assistance programs. And employee assistance programs at this point certainly are a very good resource for folks that may want to talk to someone. So some of the things that are available through an EAP program, I'm sure many people are familiar, but again, just to call out, we do offer an employee assistance program. It is available 24/7, so you can always reach a live person. Not only is this a good resource for employees and or family members that, again, may be feeling very stressed out and anxious about this, but also any managers that are having a hard time with dealing with the questions and responses and those sorts of things to this current outbreak, again, can be a really good opportunity to recommend that as a service and as an option for them to go ahead and talk to someone. And since it is primarily telephonic, you don't have to go into an office. You don't even need to leave your house, so you can do it all via the phone. Just a couple of other sources that I would recommend folks take a look at and resources. One certainly is the myuhc.com and Health for Me app. You can search for providers there. You can certainly do all of your claims tracking and those sorts of things, but also there are a number of health resources on our website. They are being updated. You can also find, for example, international providers that would be certified to treat and practice medicine at an international level. So again, where you're being treated and where are the appropriate places to go is even more important now. So that's an excellent resource to get that. I mentioned the employee assistance program, but again, excellent resource for folks that need to speak to someone. And then Intelligence Center. So we have a host of information, medical information, security information, alerts, country information, with all the travel restrictions and things that have been going on recently, and they do change. It seems like by the hour, we have been sending out a lot of alerts so that people know what are the latest travel restrictions, what are the latest alerts that they need to be aware of, what are the situations going on around the world. So for someone that doesn't have the luxury of essentially being able to sit in front of a computer and just constantly research the latest stuff from the CDC or others, we are actively pushing out information and notifications related to all of the latest developments, again, whether or not it's COVID-19 or security situations or those sorts of things, so that people can stay well informed. Also, My Wellbeing, one of the things that people can do to help reduce stress as well as keep their immune system healthy is leading a healthy lifestyle. And so this is, again, just another resource for folks if they are looking for that sort of encouragement. My Wellbeing is an excellent place. And then finally, virtual visits is something that we've gotten a lot of questions about recently. It is an excellent option right now because certainly you can do it from wherever you are. You don't need to go into an office setting or a hospital. So it is a really good place to start. If you are feeling sick or some symptoms, having that first virtual visit with a physician to go through your symptoms and be able to explain them, have them react to it, and really let you know whether or not this is something that they feel can be treated at home or whether or not you should seek medical care. So virtual visits is an excellent opportunity for still getting the medical care that you need, but not actually having to go into an office setting. The other thing that I'll just sort of say on that is if you are planning to go into or believe you need to see your primary care physician, it is a really good idea to call them ahead of time and let them know what your symptoms are. That way they're able to prepare, as well as if it's not necessary, then you can know that. So just showing up to your doctor's office because you're feeling sick is not advisable. The other thing is certainly going to the ER for routine and non-urgent medical needs is even more important right now, because medical systems will have increased volume, and the likelihood that you have gone and potentially exposed yourself to either something that you didn't have before or exposed other people in an unnecessary situation is quite real. So just a little bit more preparedness and upfront conversations with your healthcare providers is really essential right now. With that, we have about 15 minutes, so we will open it up for some questions. We have a number of questions that are coming in through the chat feature, so I'm going to go through some of these and we can start to address those for you. One of the first questions that we've gotten is, should we be implementing a work from home policy at this point in time? Several employers have instituted some form of work from home policy or flexible schedules. I think that's going to be a decision that each individual employer has to make. But Dr. Arwindekar, any thoughts on whether or not we have reached a point where work from home should be mandatory for all employees?
You know, that is a business by business decision. I know in certain jurisdictions the government is stepping in and really recommending that everyone work from home. That's happened in at least 1 or 2 states in the United States currently, where the governor of Illinois came out yesterday and recommended that anyone who can work from home does work from home. We as an organization are not recommending that yet, but I would recommend checking with your local authorities to see what they say on that topic.
Thank you. Another question, practical question. If you feel as though you have symptoms and would like to be tested, how can you find a medical facility here in the U.S. that has the test available, or what should you do to get tested?
So, the process for testing is currently still under some degree of control and restriction by state and federal authorities. So if you feel you may be exposed or are having symptoms, the first step is to contact the local state or health authority. Phone numbers are available online. If you Google them, contacting them will, you'll go through a screening process with them, and then they can direct you to a location to get your testing. We are hopeful that within the next couple of weeks, testing will become broadly available to any physician who wants to order it, but we're still waiting on that.
Excellent. Couple of questions that have come in. We've seen these quite frequently. The first one, how long is our best understanding that the COVID-19 virus can live on surfaces? And then as a follow-up question to that, although unrelated, if you have contracted it and recovered, are we seeing cases that someone then can then become reinfected?
2 really good questions. So the answer to both of them is we're not exactly sure yet, but we can extrapolate some answers. So for the question of how long does it survive on a surface, based on other coronaviruses, the window is kind of broad depending on what the surface is. The virus survives better on some surfaces than others. So for things like plastic, it can survive up to several days, up to about 72 hours. On other non-porous surfaces, it survives only for a few hours. Now, the thing is, this is why we're really recommending disinfecting surfaces frequently, because from what we can tell, the common antimicrobial cleaners are effective, not necessarily the antibacterial ones, but just the standard disinfectants are fairly effective in keeping areas clean. Your other question about is it possible to become reinfected? Quite frankly, we don't know yet. And the big part of the reason for this is that it's only been 3 months since this really became a broad outbreak. Uh, we haven't had enough time to check. Have been cases of people who continue to test positive for long periods of time, even though they're not showing symptoms, but we're not sure if that really is a secondary infection or if that's just the first one lasting longer. So that's still in the realm of we're not sure. One of the questions we're getting asked very frequently is um, how this affects different ages differently. As I said before, people who are young are having very, very mild illnesses. Children in particular are doing exceptionally well with this in that they are wonderful at passing it to other people, but they are not getting infected or having bad outcomes themselves. On the other side of the spectrum, people over the age of 60, which in the US constitutes 20% of the population and in Europe constitutes over 30% of the population, they have a mortality rate that goes up with every decade. So in their 60s, people in their 60s, we're seeing them unfortunately die at a rate of 1 to 5%, depending on the country you're in. Once you get into your 70s, that rate goes up anywhere to 4 to 15%. Now, we're expecting those numbers to come down some, but you can see that there's a wide spread of how this affects children who are perfectly remain healthy versus typically their grandparents and great-grandparents who can become very ill and often die from this. A big part of the reason for that is this is how much sort of reserve you have left, how healthy you are, plays a big factor in how you react to this virus. And people who are younger and healthier tend to do much better.
Couple of additional questions on data that they've been seeing. So a few things. First of all, there have been a big variety in terms of sort of the mortality rate of COVID-19 from one country to the next, and how can we explain that? And I think an additional point to this would be, what is the current state of testing in different locations around the world, and is that affecting our true understanding of the spread of coronavirus and the prevalence?
Sure. Different countries have approached testing for coronavirus very differently, and that really directly impacts the mortality numbers that you are seeing. So if you look at South Korea, which once they started having the early signs of an outbreak, implemented very, very broad liberal testing. They tested 190,000 people within about 2 weeks. They have the lowest mortality rate, somewhere in the range of 0.7%. And that is because they fully understood who had it and got a broader denominator. Whereas places like Italy and the US, we're only testing people who are sick. And some of those people who are sick are dying. But we're probably missing a lot of people who have the very, very mildest forms of the illness and are acting as the vectors that are transmitting it amongst other people who are showing worse symptoms. The US is slated to move towards a more liberal policy of allowing testing over the next few weeks as they ramp up production of the test in the United States. The current turnaround time for this test is roughly 48 hours, and that's because the test takes a couple of hours to run, but there's transport time between the location where the test is drawn and the lab that runs it. We're hopeful that as the private sector is getting more engaged in creating this test and ramping it up, that we'll see those times come down and we'll get more data on how many people are actually infected, which will lead to a drop in the mortality rate as we catch more people who have very mild illnesses, and we understand who is spreading it back and forth.
Excellent. Couple of questions that also routinely come up. If individuals have vacations, family vacations planned within the continental U.S. as an example, should they be reconsidering those travel plans? And then also, as a related question from a business standpoint, one of the questions we got is, are we seeing employers instituting a sort of self-quarantine policy for employees after they've come back from a vacation? So I'll take the second part if Dr. Arwindekar, you want to take the first part.
The question of, is it safe to travel, should I travel, is a very personal question for everyone, because it's going to come down to your overall risk. If you have family members who are, grandparents or anyone who's over the age of 60, your risk of having a bad outcome from this is higher, not for yourself, but at least for your family. And it would be something that you need to consider when you're making your travel arrangements. Avoiding public places is a big part of how we try to limit the spread of this virus. And when traveling, it's difficult to limit that exposure. I don't know if I want to go so far as to say we should, limit, make anyone's decision for them on whether or not they should travel, but there are risks to consider. The other side of this is also remember that this infection for 80% of the population is very, very mild. So the risk to anyone under the age of 60 without chronic medical problems is very low for any long-term bad outcomes.
And from a business perspective, I would say that we have not necessarily seen widespread requirements that someone who has taken a vacation, especially if they've traveled within the United States, being forced to self-quarantine for 14 days. That answer changes a little bit if someone has traveled internationally, especially to certain locations, such as Italy, South Korea, China, for example, Iran, although not many people are going on vacation there. Anyway, so we have not seen it as a widespread policy being put in place, but certainly it is a good idea to communicate to your employees that if you have traveled and you get back and you have any symptoms, even mild symptoms, you should continue to stay home and not bring those symptoms into the office. Again, whether or not it's COVID-19 or a cold, it is very hard to tell at this point because the symptoms are very similar, and it's not a good idea if you have any symptoms at all to return to work, whether or not you've been on a business trip or if you've been on a personal trip. I think we've got time for essentially one more question before we sign off. The question is, many supplies of disinfectants are being rapidly taken off the shelves by people who are stockpiling them and would like things like Purell and Lysol sprays and those sorts of things. So if you are in a location where these products, off-the-shelf products, are not available, are there substitutes or things that you can make at home which effectively will act as a disinfectant for COVID-19 or other pathogens?
I don't recommend making your own disinfectants at home or your own cleaning supplies. A lot of the chemicals used in these are fairly potent at concentrated amounts. What comes out of the can or the container is safe for use, and I would recommend doing your best to secure supplies of those products.
Excellent. So a couple of other just sort of housekeeping items, because we did get asked this quite a bit. Aaron, I am going to ask you to address this, but A, will the presentation be shared with everyone, and where can they find a copy of the presentation and the recording of the webinar should they want to reference it again?
Excellent questions. So a copy of this presentation will be available on uhcglobal.com. When you receive your thank you email after this presentation, there will be a link in the email that will take you directly to this presentation. The recorded version of the presentation can be found on our YouTube channel, and within the search bar on YouTube, simply type in UnitedHealthcare Global, and you will see the video on our YouTube page.
Excellent. Thank you all so much for joining us today. We appreciate the opportunity to share the latest information that we have had. If you do have any follow-up questions, please feel free to reach out to your SCE or your sales representative, and we will be sure to get all of your questions answered. Thank you again. Have a great weekend, everyone, and we appreciate everyone joining today. Thanks, and bye-bye.